I'm Steve Hines. I am involved in a clinic in Mexico now for 25 years, and we do kind of a different type of medicine there. It's somewhat an integrative approach, but it's also very much the result of looking for the cause of an illness rather than treating the symptoms. And even in integrative medicine, that's not generally the case. Typically, you'd look at a rheumatologist and somebody's got a joint problem, joint pain. Rheumatologists, they'll say, well, let's just inject it with some steroids or some rooster cone. Well, instead, the integrative people say, well, let's use stem cells. Our approach is that we want to know why the degeneration of the cartilage occurred to begin with. And so we're very much cause-oriented. And so I want to just preface what I'm about to say, that this video is for educational purposes. It is not deemed to be giving medical advice or treating a patient. So this is mostly for doctors. If you're a non-doctor watching this, well, maybe you can share it with your physician who's open-minded. But the particular subject I want to talk about today is one that happens a lot. We see people come in from MD Anderson or Scott and White or whatever cancer hospital they've been treated at, and they'll come into the clinic sometimes in a wheelchair, and they're just, can't even stand up. They're so tired. And we'll look at their labs that they bring in. I remember one case, it was only like 3 days since the oncologist said, there's nothing else we can do for you. So come on and let's go to hospice. So a lot of our patients are on hospice when they come because they've already failed the conventional model, the chemotherapy, surgery, and sometimes even bone marrow stem cell therapy. And I see this happen a lot where their labs show their white blood counts maybe 18 to 20,000, and their ferritin is in the thousands, like 2,000 or 3,000. And I'll ask the patient, did your oncologist tell you that you had an infection? And that, no, he just said there's nothing else they could do for us. And so when I ask them, have you had blood transfusions? Oh yeah, 5, 6, 7, or 8. This happens a lot because their hemoglobin drops, hematocrit drops, and they're no longer able to give them chemotherapy. So they start giving them Neupogen, the shots, things to stimulate the bone marrow to make more white blood cells and red blood cells. Well, it's interesting how many times, and this happens all the time, somebody comes in that's extremely fatigued condition, oftentimes with a lot of pain, and we see the labs, their white blood count's high, the hemoglobin's low, and I'll just say, well, did you get any kind of antibiotics for your infection? And I say, no, I didn't even know I had an infection. So we will give them IV Rocephin, and the next day they're walking around the mall, and they'll say, man, my pain is mostly gone. And so this really bothered me for a long time because they're sending people home to die and they're blaming it on the cancer. Well, you have to understand that when you've taken 10, 15 rounds of chemotherapy, maybe they've done radiation to the bone marrow or to a targeted organ, the treatment for the cancer oftentimes does so much more harm than the cancer would have under the time frame and the circumstances. So we're trying to find out why these people are fatigued. Yeah, they got cancer, but a lot of people have cancer and they feel fine. So we'll give them an IV antibiotic, and very, very often the next day they feel tremendously better. And we may do it for 3 or 4 days in a row to make sure that we've dealt with the infection. Well, why is it that doctors miss this? Why do they see a white count at 16 or 18,000 and a low hemoglobin, and they just, oh, well, it's just the cancer? Well, you know, what really is more likely happening is that the chemotherapy has damaged the bone marrow. So they're not producing red blood cells, and their hematocrits low. Therefore, they don't have any oxygen carrying capability. So we will also hear very often that, yeah, the doctor told me my hematocrit was low, and they gave me a bunch of iron for that. This is the last thing you ever want to do when you have someone that's already got high iron, and they see that as the ferritin being high. But you have to understand there's this concept that I coined a phrase years ago. It's called the chronic acute phase reaction. Well, in normal biochemistry and immunology, you know, all doctors are taught this, that if you have an active infection, the body's immune system will begin to sequester their free iron to get it out of circulation, because bacteria grow like a house on fire when there's plenty of iron. And if you look at it from a laboratory standpoint, you'll generally see that the ferritin is high when the white blood count's high, and you'll see that total iron binding capacity is usually very low. Now, doctors, 90% of the time, they see a low total iron binding capacity, and they see that as you're out of iron. Well, if your ferritin is high and your serum iron is in reasonable range, 80, 90, 100, it's just the opposite. And so they end up giving them iron, which makes their cancer cells grow like a house on fire if you have cancer, or the bacteria will grow crazy out of control. I've seen it kill people because it took a reasonably under control infection and turned it into a house on fire. So here's how you have to read this picture. You need a serum iron, you need a ferritin, and a total iron binding capacity. And so because the TIBC is an inverse relationship, let me give you an axiom. If I have a pickup truck and my bed is empty, my carrying capacity is very high because the truck's empty. Conversely, if it's totally full, I've got hay bales all the way up to the roof cab, then my binding capacity is very low. So it's very confusing. And even knowing this, I have to think about it a lot. So iron binding capacity, when it is low, it means iron is loaded up. All the carrier proteins are loaded. When you look at ferritin during an acute phase, and that is, all doctors know this, when you have the acute phase reaction going on, the body is grabbing the iron, taking it out of circulation, storing it in a protein called ferritin. And the largest percentage of that is actually in your liver, which is very important from a clinical perspective. So how do you discern between they really do have high iron or they have really low iron? You have to look at TIBC, serum iron, and ferritin, and sometimes you need a erythrocyte sedimentation rate, and you need a C-reactive protein. So when you see C-reactive proteins high, sedimentation rate is high, you know there's a lot of cell turnover going on. There's a lot of inflammation. So that gives you a clue then if your iron binding capacity is low, ferritin is high, serum iron is reasonable in the middle range, then you know that the body is responding to an infection. Now that is the principle of the acute phase reaction. But after many, many years, probably 25 years of dealing in the area of chronic infections like Lyme disease, cat scratch fever, which is coccobacilli, that we lost more troops, both the German troops and the Allies in the European theater during the Second World War, to trench fever, which is coccobacilli or Bartonella. There were very poor options at that time for treatment, maybe some sulfa drugs. But we lost more troops to that organism they called trench fever than we did to guns and bullets and bombs. At least that's what a paper I read said. But most of the time, Bartonella doesn't just go away. It may become somewhat quiescent. It gets really deep in the tissues. The immune system just stops the violent reaction. You see this with Lyme disease. You see it with Babesia. You can see it with some types of malaria, particularly malaria 4. There are many infections, Chlamydia pneumoniae, Mycoplasma. You may have an acute phase reaction initially, but after a while, their IgM antibodies go down, IgG antibodies kick in, and the doctor just says, oh, well, it looks like you kicked the infection. Well, I'm now sharing with you what I have called now the chronic acute phase reaction. And it's much more subtle than the acute phase, because the immune systems has kind of got to the point where it says, hey, you guys stay over there, we're going to stay over here. It's just too much problem, we're tired. So when you look at the iron binding capacity, the serum iron, the ferritin, the erythrocyte sedimentation rate, the C-reactive protein, you can begin to see this picture that maybe you did have the organism, maybe the IgM antibodies went away, but the infection is still there. Now, this is very hard for the conventional doctors to get, because they've been told in medical school, if IgM's high, it's an active infection. If it's low and IgG's up, then it's over with. Your body fought it off. You don't need the IgM anymore, so IgG takes over. So if you ever see that infection again, your immune system would respond very quickly. And so for the most part, that's true. If you're talking about staph or strep, Klebsiella pneumoniae, something like that. But when it comes to the zoonotic infections, like Lyme disease, Babesia, which we nicknamed it American malaria because it's so common and it's treated almost identically in most cases to malaria. Thing is, Babesia almost always goes chronic. You know, we've been practicing at our clinic in Mexico with a very large microscope. It blows it up, one drop of blood looks like a tangerine on the screen. And you can oftentimes see a little circle right in the middle of the red blood cell. And it's shimmering. We call it a signet ring. That is oftentimes Babesia. Now, there's a lot of different Babesias. Some of them don't look that way. Others do. And then over the years, we've treated people who had joint pains with medications that are specific for Babesia, and their joint pain goes away. We've also found that people who have, particularly a lot of women that have night sweats, and we get their hormones balanced perfectly, yet they still have night sweats. When we test them for Babesia and find it positive, when we treat them successfully, their hot sweats go away. So a lot of things look hormonal that are not, they're just infections. And so in the case of joint pains, Babesia really love the joints, and they'll just chew on them and chew on them. So from our perspective, we're trying to find out why people are ill, not just treating the symptoms. And one of the worst things I ever see in rheumatology, so much of people's joint pains, muscle pains, fibromyalgia type stuff is due to an infection. And what do they give them? Prednisone. They give them long-term dexamethasone. they'll give them some kind of TNF alpha inhibitor. That's the new thing these days. So it knocks out the immune system, which allows the chronic infection to get worse and worse and worse until one day it can be fatal. So to discern between acute phase and chronic acute phase, which is the same thing, but it goes on at a low level for many years. When you start seeing really low levels of iron, but ferritin is in normal range, then you can say they really are losing iron. And of course, we always ask them if they're having any bleeding in the stools, if they're having hemorrhaging, it generally shows up in the stool if it's gastric. And if they deny that, then we ask them if you have joint pains. Yeah, I've got joint pains for a long time. So in that case, what can happen is Babesia, akin to malaria, they actually will cause red blood cells to lyse. They'll destroy them. When the red cells degrade, the iron can go with them. So you can actually have a real true iron deficiency. But it's very important to be able to discern one from the other. And so from a clinical perspective, we have to have a lot of information. We have to ask a lot of questions. Otherwise, we're going to give people the wrong thing. And this is so typical in the cancer world. When somebody comes in, they got a high white count, and the doctor's given them iron, or they've given them a lot of blood because their hemoglobin was low. Sometimes that's absolutely necessary. But every time you take in a donor blood, you're getting the iron from that donor. And so the more chemo they take, the more blood they need, or the more iron they give them, eventually their ferritin gets so high it's uncontrollable. But they are also feeding the cancer, or in the chronic acute phase, from a bacterial standpoint, they're actually making the bacteria grow and grow and grow. And if you don't deal with that quickly, you're going to lose the patient. So this is just a little smattering of the things that we do at Hope Wellness Center in Mexico. Is we look for underlying causes, as we hate treating symptoms. We want to know what caused someone to become ill. And myself, I had high iron for a while. I started I'd take an IV of saline, I'd just take the bag, lay it on the ground, and fill up 500 and 250 mLs of blood and throw it in the trash. I like to keep my iron around 90, because iron is a big thing. It was one of the longest standing lawsuits with the Federal Trade Commission. I think it was like 19 years. And it was Procter & Gamble versus, I believe, the FDA. And it was from giving women Geritol. And people just say, oh, well, take some more Geritol. Well, it was full of iron. And we all remember it, if you're old enough to remember, Geritol for iron poor blood. More women became ill because of that probably than any other single supplement that was misused in history. Their iron levels got so high it fried their liver, or it can cause excessive free radical damage and cause macular degeneration. It can make other infections in the body grow like crazy. So it can cause atherosclerosis. It can cause diabetes, which then creates a whole other bunch of problems. So we're very, very aware continuously about iron levels, why they're high or low. And so we don't make mistakes and give iron to someone who does not need it. And so I hope that that's helpful for the physicians out there that are trying to, they're on the front line trying to do the right thing, but there's an awful lot to know. And like one of my oncology friends said, he said, Steve, medical school was a long time ago. Things have changed, we forget things, and we don't often have the time to think through. So this is a little tutorial that I hope will help bring back some memories of biochemistry and immunology and maybe shine some new light on them. So I hope that's helpful.